Steve Harvey had maintained a disciplined approach to his health throughout his professional career, understanding that the demanding schedule required for hosting multiple television programs, conducting speaking engagements, and managing various business ventures necessitated physical fitness and regular medical monitoring. During a routine annual physical examination in June 2025, his physician identified an irregularity that required additional diagnostic evaluation. This discovery would lead to a revelation that connected his present circumstances to a long-forgotten encounter from decades earlier, demonstrating how seemingly minor acts of intervention can have profound long-term consequences that remain invisible until circumstances reveal their significance. Viewers who value content exploring themes of interconnection, the lasting impact of seemingly small actions, and the ways that past and present converge in unexpected ways are encouraged to subscribe to this channel and engage through available mechanisms. The medical evaluation that initiated this sequence of events occurred during Steve's standard annual comprehensive physical examination, a procedure he had maintained consistently for over 15 years as part of his commitment to preventive health management. His physician, Dr. Michael Richardson, had been Steve's primary care provider for the past decade and maintained thorough records regarding his patient's health history, risk factors, and family medical background. During the current examination, Dr. Richardson identified an elevated prostate-specific antigen level that warranted further investigation through additional diagnostic procedures. While such elevations could reflect various conditions ranging from benign inflammation to more serious pathology, Dr. Richardson explained that given Steve's age and the degree of elevation observed, proceeding with additional evaluation represented appropriate medical precaution rather than cause for immediate alarm. The subsequent diagnostic procedures included imaging studies and biopsy samples that would provide definitive information regarding the nature of the abnormality. The waiting period for results from these procedures created understandable anxiety for Steve and his family, as any potential cancer diagnosis carried significant implications for treatment planning, professional scheduling, and long-term health outcomes. During this period, Steve maintained his professional commitments while privately managing the uncertainty and stress associated with awaiting potentially life-altering medical information. He had informed only his immediate family and closest professional associates about the situation, preferring to maintain privacy regarding health matters until definitive information became available that would inform appropriate next steps. The diagnostic results returned after approximately 2 weeks and indicated early-stage prostate cancer that appeared to be confined to the prostate gland without evidence of spread to surrounding tissues or distant sites. Dr. Richardson explained that while any cancer diagnosis was serious and required prompt treatment, the early detection provided substantially better treatment options and prognostic outcomes than would be available if the condition had been identified at a more advanced stage. He emphasized that prostate cancer detected early, as in Steve's case, was highly treatable with excellent long-term survival rates when appropriate interventions were implemented promptly. The treatment options available included surgical removal of the prostate gland, radiation therapy, and in some cases active surveillance with close monitoring, with the optimal approach depending on various factors including the specific characteristics of the cancer, the patient's overall health status, and individual preferences regarding treatment-related side effects and quality of life considerations. Steve and his family engaged in extensive consultation with medical specialists to understand the treatment options comprehensively and to make informed decisions about how to proceed. After thorough evaluation and discussion, the decision was made to proceed with surgical intervention to remove the prostate gland, a procedure that offered the advantage of definitively removing the cancerous tissue while providing complete pathological analysis that would confirm whether the cancer had been entirely contained within the gland or had begun to extend beyond it. The surgery was scheduled for several weeks following the diagnosis, providing time for necessary preparation and for Steve to arrange his professional schedule to accommodate the recovery period that would be required following the procedure. During the consultation process with the surgical team that would be performing the procedure, Steve learned information that would fundamentally alter his understanding of the circumstances that had led to this early detection. The lead surgeon, Dr. Patricia Chen, was reviewing Steve's complete medical history as part of the pre-operative evaluation process when she noted something in his records from many years earlier that caught her attention. She inquired about an emergency room visit that had occurred approximately 23 years prior, when Steve had been treated for injuries sustained during a minor automobile accident. Steve recalled the incident vaguely, remembering that he had been rear-ended while stopped at a traffic light and had been taken to an emergency room for evaluation despite not having sustained serious injuries. Dr. Chen explained that the medical records from that emergency room visit included notation that the treating physician had identified an irregularity during the physical examination that had prompted recommendation for follow-up with a primary care physician for further evaluation. Steve acknowledged that he had received such a recommendation, but admitted that given the demands of his career during that period and the fact that he had felt completely healthy, he had not followed through with the recommended appointment. He had been in the early stages of building his career in television at that time, working constantly and prioritizing professional opportunities over medical appointments that seemed unnecessary given his lack of symptoms. Dr. Chen nodded with understanding, but explained that the notation in his emergency room records from that distant visit had documented an enlarged prostate that the examining physician had identified during the evaluation. While prostate enlargement was common and often benign, the physician had noted that given Steve's relatively young age at that time, the finding warranted follow-up evaluation to establish baseline measurements and ensure appropriate monitoring over time. The significance of this historical notation became clear as Dr. Chen explained that had Steve followed through with the recommended evaluation 23 years earlier, he would have established a pattern of regular prostate monitoring that would have detected any concerning changes at the earliest possible stages. More importantly, the fact that a physician had identified and documented this finding during an unrelated emergency room visit represented a fortunate circumstance that had created a paper trail in his medical records that subsequent providers could reference. Dr. Chen indicated that she wanted to identify the physician who had made that original notation, as that individual's attention to detail during what was presumably a busy emergency department shift had potentially saved Steve's life by creating documentation that informed current clinical decision-making and by attempting to ensure appropriate follow-up even though Steve had not acted on the recommendation at that time. The administrative staff located the records from the emergency room visit and identified the treating physician as Dr. James Whitaker, who had been completing his emergency medicine residency training at the time he had examined Steve. Dr. Chen's office reached out to the hospital where Dr. Whitaker had trained to inquire about his current location and contact information, hoping to inform him that his thoroughness during that long-ago examination had contributed to potentially life-saving early detection of cancer in a patient he had treated briefly decades earlier. The hospital indicated that Dr. Whitaker had completed his residency and had subsequently practiced emergency medicine at various facilities before eventually leaving clinical practice to work in medical education, where he currently served as a faculty member teaching emergency medicine to resident physicians at a major academic medical center. Steve expressed strong interest in connecting with Dr. Whitaker to thank him personally for the attention to detail that had created the medical documentation that informed current treatment planning. His team arranged contact with Dr. Whitaker through the academic medical center where he was employed, explaining the circumstances and inquiring whether he would be willing to speak with Steve regarding the long-term impact of his clinical thoroughness during that emergency room encounter 2 decades earlier. Dr. Whitaker responded with surprise, indicating that he had no specific recollection of treating Steve Harvey and that he had examined thousands of patients during his years in emergency practice, making it impossible to remember individual encounters from so many years prior. However, he expressed willingness to speak with Steve and indicated that learning his documentation had contributed to early cancer detection represented meaningful validation of the importance of thoroughness in medical practice. The conversation between Steve Harvey and Dr. James Whitaker occurred via video conference several days before Steve's scheduled surgery. Dr. Whitaker appeared on screen as a man in his early 50s with graying hair and the tired but engaged expression common among physicians who maintained demanding teaching and clinical responsibilities. He explained that he had reviewed the records from Steve's emergency room visit and that while he had no independent recollection of the encounter, he could provide context regarding his approach to patient examination during his residency training that explained why he had noted the prostate finding even during an evaluation focused primarily on potential injuries from the automobile accident. Dr. Whitaker described how his residency training program had emphasized the importance of complete physical examination rather than narrowly focused evaluation of only the presenting complaint. He explained that emergency physicians frequently encountered patients who had limited access to regular primary care and for whom an emergency department visit might represent their only interaction with the healthcare system for extended periods. His training had instilled the practice of conducting thorough examinations that might identify conditions requiring follow-up even when those conditions were unrelated to the immediate reason for the emergency department visit. In Steve's case, the protocol for evaluating potential internal injuries from the automobile accident had included abdominal and pelvic examination, during which Dr. Whitaker had noted the enlarged prostate and had documented this finding along with a recommendation for follow-up evaluation. Dr. Whitaker acknowledged that many patients did not follow through with recommendations for non-urgent follow-up, particularly when they felt well and faced competing demands on their time and attention. He noted that emergency physicians understood this reality but made the recommendations nonetheless, recognizing that creating documentation in medical records provided information that might benefit patients years later, even if they did not act on the recommendations immediately. He expressed satisfaction that his notation from so many years earlier had indeed served this purpose by informing current providers about a baseline finding that gave context to current abnormalities and by reinforcing the importance of prostate monitoring given the historical documentation of enlargement. Steve thanked Dr. Whitaker for his thoroughness and for taking time from his current responsibilities to participate in this conversation. He explained that learning about the connection between that long-ago emergency room visit and his current diagnosis had prompted reflection about the ways that seemingly routine professional actions could have profound, long-term consequences that remained invisible to the individuals who performed them. He noted that Dr. Whitaker had likely conducted thousands of examinations and had documented countless findings during his years in emergency practice, most of which would never be known to have influenced subsequent patient outcomes, yet his consistent thoroughness had created the conditions for early detection that was now potentially saving Steve's life. Dr. Whitaker responded that this conversation illustrated why he had transitioned from clinical practice to medical education. He explained that teaching young physicians about the importance of thoroughness, documentation, and patient-centered care that extended beyond addressing only the immediate presenting problem represented his effort to multiply the impact he could have on patient outcomes. Every resident he trained who internalized these principles would go on to examine thousands of patients over the course of their careers, and some unknown percentage of those examinations would result in findings that had long-term significance, even if the individual physicians never learned about the ultimate outcomes. He expressed hope that Steve would share this story publicly if he felt comfortable doing so, as it provided powerful illustration of principles he attempted to teach his residents about the importance of thoroughness, even when immediate benefits were not apparent. The surgery proceeded as scheduled several weeks following this conversation with Dr. Whitaker. The procedure was successful, with pathological examination confirming that the cancer had been entirely confined to the prostate gland without extension to surrounding tissues, indicating that complete removal had been achieved and that additional treatment beyond regular monitoring would likely not be necessary. Steve's recovery progressed according to expected timelines, and he was able to resume his professional activities within the anticipated timeframe with appropriate modifications during the initial recovery period. The excellent outcome was directly attributable to the early detection that had enabled intervention before the cancer had advanced to stages that would have required more aggressive treatment and would have carried less favorable prognosis. Several months following his surgery, and after receiving medical clearance confirming his recovery and the absence of any residual disease, Steve made the decision to discuss his diagnosis and treatment publicly. He felt that his experience could serve important purposes, including encouraging men to prioritize regular health screenings, demonstrating that early detection of prostate cancer offered excellent treatment outcomes, and illustrating how thoroughness in medical practice could have profound long-term impacts even when immediate benefits were not apparent. He arranged to tell the story during a taping of his daytime talk show, with Dr. Whitaker participating via video connection to provide his perspective on the significance of the emergency room encounter from 2 decades earlier. The episode featuring Steve's disclosure of his cancer diagnosis and treatment, along with the revelation about Dr. Whitaker's role in creating the documentation that had informed early detection, generated substantial public attention and discussion. Media coverage emphasized both the medical aspects of prostate cancer screening and early detection, and the human interest elements of the story regarding how a young resident physician's thoroughness during a routine emergency room examination had contributed to potentially saving a patient's life more than 20 years later. Public health organizations noted measurable increases in requests for prostate cancer screening following the episode's broadcast, suggesting that Steve's willingness to discuss his experience publicly had motivated other men to prioritize preventive health measures that they might otherwise have postponed or avoided. Dr. Whitaker reported that the public attention resulting from the episode had prompted numerous communications from former patients and colleagues sharing their own stories about how his thorough approach to patient care had influenced their health outcomes or their own professional practices. He indicated that while the attention had been somewhat overwhelming, it had validated his decision to prioritize teaching and had reinforced for his current residents the importance of the principles he attempted to instill. He noted that Steve's story had become a centerpiece of his teaching about documentation, thoroughness, and the long-term impact of apparently routine clinical actions, providing concrete illustration of abstract principles that were sometimes difficult for trainees to fully appreciate when facing the immediate pressures of busy clinical environments. The broader impact of Steve's public disclosure included renewed discussion about barriers to preventive health care that disproportionately affected men, particularly regarding conditions like prostate cancer, where screening required discussions and examinations that many men found uncomfortable or embarrassing. Healthcare professionals and public health advocates emphasized that early detection depended on individuals overcoming reluctance to seek care, and that cultural attitudes normalizing avoidance of medical attention represented obstacles to optimal health outcomes. Steve's willingness to discuss his diagnosis openly, despite the personal nature of the condition, was cited as example of how public figures could influence social norms and encourage healthier attitudes toward preventive care and medical treatment. The connection between Steve Harvey and Dr. Whitaker that had been revealed through the cancer diagnosis developed into ongoing relationship following the initial public disclosure. Steve invited Dr. Whitaker to participate in subsequent discussions about healthcare access, medical education, and the importance of preventive care, providing platform for perspectives that might not otherwise reach broad audiences. Dr. Whitaker utilized these opportunities to discuss systemic challenges in healthcare delivery, including inadequate compensation for thorough primary care that emphasized prevention over acute intervention, barriers to medical education that limited diversity among healthcare providers, and the importance of policies that enabled rather than constrained physician thoroughness and patient-centered care. 2 years following his surgery, Steve marked the anniversary by hosting a special program examining how his experience had influenced his perspectives on health, mortality, and the use of his platform to address issues with social significance beyond entertainment. He discussed how the cancer diagnosis and subsequent treatment had prompted reflection about priorities and about the responsibility that accompanied his public visibility. He acknowledged that his initial reluctance to discuss his health situation publicly had reflected common instincts toward privacy regarding medical matters, but that recognizing the potential impact of sharing his experience had motivated him to prioritize public benefit over personal comfort. He expressed gratitude to Dr. Whitaker not only for the clinical thoroughness that had contributed to early detection, but for the example Dr. Whitaker provided of how professionals could multiply their impact through teaching and through consistent adherence to principles, even when immediate benefits were not apparent. Dr. Whitaker appeared on the anniversary program to provide updates on changes in prostate cancer screening guidelines and treatment approaches that had developed during the 2 years since Steve's diagnosis. He emphasized that while Steve's story had positive outcome, it illustrated both the value of early detection and the problems created when individuals delayed or avoided preventive care. He noted that many men diagnosed with prostate cancer had less favorable outcomes than Steve's because their disease had been detected at more advanced stages when treatment options were more limited and prognosis less optimistic. He encouraged viewers to learn from Steve's experience by prioritizing regular health screenings rather than waiting until symptoms appeared, as many serious conditions including various cancers could be addressed far more effectively when detected early through screening rather than later through symptom-driven diagnosis. The educational impact of Steve's public discussion of his cancer diagnosis and treatment extended beyond immediate increases in screening requests to influence longer-term changes in how men approached health management. Research conducted by public health organizations indicated sustained increases in prostate cancer screening rates among demographic groups that had previously shown lower engagement with preventive care, suggesting that Steve's story had influenced behavior beyond the immediate response to media coverage. Healthcare providers reported that patients frequently referenced Steve's experience when explaining their motivation for seeking screening or when overcoming reluctance to follow through with recommended procedures, indicating that his public disclosure had provided framework that enabled men to prioritize their health without perceiving such prioritization as weakness or excessive caution. The connection between a routine emergency room examination conducted by a resident physician and the early detection of cancer more than 2 decades later illustrated broader principles regarding the importance of thoroughness in professional practice and the ways that seemingly minor actions could have profound consequences that remained invisible until circumstances revealed their significance. Whitaker's documentation of an incidental finding during an examination focused primarily on evaluating potential injuries from an automobile accident had created information in medical records that informed subsequent clinical decision-making and that had potentially saved Steve's life by establishing a pattern that made current abnormalities more significant and concerning than would have appeared without historical context. The story also demonstrated the value of long-term relationships between patients and healthcare providers, as Dr. Richardson's decade-long tenure as Steve's primary physician had enabled him to review historical records comprehensively and to identify patterns that might have been less apparent to a provider with more limited access to longitudinal information. The continuity of care that such long-term relationships provided facilitated earlier detection of concerning changes and more nuanced interpretation of clinical findings based on knowledge of individual patient histories and risk factors. Public health advocates emphasized that policies and payment structures that supported rather than undermined such continuity of care represented important investments in population health that generated returns through earlier detection and more appropriate management of chronic conditions. As this account reaches its conclusion, several principles emerge that warrant emphasis. Professional thoroughness and attention to detail can have profound long-term consequences that remain invisible to the individuals who demonstrate such qualities, with seemingly routine actions potentially influencing outcomes years or decades later in ways that are never known unless circumstances reveal those connections. Dr. Whitaker's documentation of an incidental finding during a busy emergency department shift had contributed to saving Steve's life more than 20 years later, though he had no awareness of this impact until circumstances created the opportunity for that connection to be revealed. The importance of following through on medical recommendations for preventive care and screening cannot be overstated, as conditions detected early through screening rather than later through symptom-driven diagnosis offer substantially better treatment options and outcomes. Steve's experience illustrated both the value of the screening that ultimately detected his cancer and the potential risks created by his earlier failure to follow through on recommendations for prostate monitoring following the emergency room visit. Public figures possess capacity to influence health behaviors and social norms through willingness to discuss their own experiences with medical conditions, particularly conditions that carry stigma or embarrassment that might otherwise discourage individuals from seeking appropriate care. The story serves as a reminder of the interconnection between past actions and present circumstances, and the ways that seeds planted through thorough professional practice can yield harvest years or decades later, even when the individuals who planted those seeds remain unaware of the ultimate outcomes. Healthcare providers who maintain consistent thoroughness and patient-centered approaches create conditions for optimal outcomes, even when they never learn about the specific impacts of their individual actions. The relationship between Steve Harvey and Dr. James Whitaker that emerged from this revelation provided mutual benefit, offering Steve the opportunity to express gratitude to someone whose actions had profoundly influenced his life, and offering Dr. Whitaker concrete validation that the principles he attempted to teach had real significance for patient outcomes. Viewers are encouraged to consider how their own professional thoroughness and attention to detail might influence outcomes in ways they will never know, and to recognize that consistent adherence to high standards generates value even when immediate feedback is absent. Individuals are encouraged to prioritize preventive health care and to follow through on recommendations for screening and monitoring, recognizing that early detection of serious conditions offers substantially better prospects for successful treatment than delayed diagnosis following symptom development.